Workplace mental health has become a significant issue and challenge for businesses throughout the COVID-19 pandemic. Employee assistance programs and general support services like Lifeline are seeing significant increases in requests for help. Pair this with the most recent statistics indicating that the average mental health-related workers' compensation claim lasting more than 20 weeks. It's certainly something that businesses need to stand up and take notice. To help shine a light on this, On Demand HR reached out to Matthew Counsel from Altius Group, a national EAP provider, to get their insights as to what's really going on at ground level. And we wanted to share this conversation with our broader audience.
No, that's great, Matt. Really appreciate that. So I guess just one final sort of question, a little bit off, probably a little bit off topic. Is there anything else you think employers should be doing? Obviously, we've spoken a lot about the EAP services that People Sense offer. Is there anything else you think employers should be doing to try and assist with managing the mental health of their employees? Would you make any other suggestions for people out there?
In terms of businesses at the moment, I think it's really important for businesses to have their finger on the pulse of what the issues are that their employees are facing. And if any employer, particularly I'm in New South Wales at the moment, I can sort of speak about our environment coming out from a prolonged lockdown. If employers don't believe that there's going to be some form of anxiety around return to work, return to normality, return to the offices, if they don't feel that there's going to be some resistance in getting people back in the office, I just think they're putting their head in the sand. We've gone through such a huge change in the way that our world has operated in the last 2 years. I truly encourage employers to start looking at that planning of return to work management. Part of that's going to be change management. Part of that's going to be educating their employees and trying to develop ways of restructuring their work to get people back into the workforce. And part of that is going to be creating a sense of well-being and making sure that employees feel that their employer is aware of these issues and they're connecting with them and they're encouraging them and supporting them through this. As much as some great news has come out recently around our vaccination numbers and things might start opening back up, I think for a lot of employers, we're not out of the woods yet. There will be opening up of businesses, but I think the mental health impact, the engagement impact, and the anxiety around return to work is something that we're going to be dealing with and supporting clients through well into 2022.
I think that certainly one thing that I've observed and one thing that I've actually spoken about at a recent CPA conference is that I see that there's going to be a number of labour market considerations here as well. I think that what we're going to inevitably see, just on that returning to the office, so to speak, mentality, is that I think employers will almost now be competing with each other on what degree of work outside of the office is offered. Because, quite frankly, what this, the last few years has shown us is that there are particularly white-collar roles, a lot of white-collar roles that really don't need a hell of a lot of office-style, presence. And, save and except for a few meetings, which even these days can be done remotely, it will be really interesting to see that side of the equation. The other challenge I'm going to see, I would say as well, on the labour market will be certainly around, vaccination or not vaccination. And I think that the reality is that when you've got an unemployment rate of 4.9%, the not vaccination rate is going to be definitely higher than that. So we've been anticipating that there's going to be some challenges for employers in terms of the labour market. To give you an example, we've got one employer next week that's going to be without 10 of their staff. And frankly, that's going to seriously disrupt their business. And it's going to be really interesting to see how employers do navigate this, because, it's going to be, whilst it may sound all well and good to make certain things mandatory, I'm not sure about the practicalities of of doing that. But sort of just going back into what you said about certainly about that return to the office, I think that's a great point. I think there'll be probably a couple of things there at play. Certainly the labour market challenges, what people expect from white collar work going forward, and also probably vaccination or not vaccination and risk levels. I suppose they'll all be factors at play. So really appreciate that, Matt. Is there any other thoughts or final thoughts on the whole general topic of mental health before we wrap up today?
Probably just touching on the trend of the trend of the statistics in the last 18 months, let alone year on year before that, which were already trending in the wrong direction. This has all escalated and has all rapidly accelerated what we were already seeing, which is a combination of a decline in our mental health as a community and a society, but also a rising self-awareness of people. And it's great to see people talking about it, having these great conversations. It's great to see more people reaching out for services, which is good. So for employers, it's not going to go away. And even from a WHS perspective, the code of practice around psychological risk has now been implemented. So if an employer hasn't really got comfortable in addressing psychological risk and understanding mental health, I think employers need to get to that point. They need to get comfortable with it. They need to be able to support their employees with it, because it is impacting on their business and it's not going away.